everybody, welcome. We are live from VIOS Fertility Institute at Mayfair Mall. We are so excited to have you joining us. Tonight, the topic of tonight's conversation is Fertility 101. The questions nobody wants to ask, but everybody kind of secretly wants to know. So we've got a lot that we want to cover. And before we dive into too much, I want to introduce you to who we have with us this evening. So on my far left over here, as we all know and love, this is the darling Lauren from Milwaukee Moms Blog, who we all love. And then next to her, we have the lovely Dr. Hayes. And then next to her, we have Dr. Ehlers. And I'm going to put you on the spot. I'm so sorry, ladies. Before we dive into questions, I want to just have you briefly introduce yourselves to the folks that are watching. We'll give just a very brief, little background of VIOS Fertility Institute before we jump into some Q&A. How does that sound?
Sure.
Awesome. Thank you. Go for it.
Absolutely. I'm Dr. Ellen Hayes. I am a reproductive endocrinologist and infertility specialist, as is Dr. Ehlers, which means that we did a residency in OBGYN, and then we did 3 additional years of training, fellowship training specific for fertility treatment. So we see women who are having difficulty getting pregnant. We see women who have sometimes congenital anomalies of the uterus. We see women with recurrent miscarriages, polycystic ovarian syndrome, so that's sort of our area of expertise. Do you want to tell them about VIOS?
Yeah, so VIOS Fertility Institute was started by Dr. Angeline Beltsos. She is one of our partners in Chicago. She was looking for a fertility clinic that would be more patient focused, so she wasn't seeing that where she was, so she decided to open her own. So we have branches in St. Louis, in Chicago, and Milwaukee, but our goal is to be very patient focused, patient friendly. We have clinics that are very warm and welcoming. Our consultation rooms are set up more like living rooms than actual exam rooms, the sterile kind of feeling you have other places. So.
You okay?
Yeah, love it.
Okay.
Right as the video starts, I'm like, oh my god, I have to cough so bad. So.
That's I used to direct live theater for middle schoolers and high schools, and we always said there's always something that goes wrong. So it's
oh my gosh, right at the beginning.
It's totally fine. Before we get into questions, I want to just kind of touch briefly on what you were talking about when it came to locations and the environment here. So we're actually located in the offices at Mayfair Mall, and this is the only location in the Milwaukee area. There's the one in Chicago as well. So when you're talking about that kind of comforting patient experience, how is that, can you elaborate a little bit more on kind of what makes that unique to VIOS Fertility Institute versus how you mentioned that kind of sterile sort of environment? How have you seen that impact the patient's experience?
Well, I've had lots of patients that have been seen in other clinics elsewhere, and they always comment on how warm and welcoming they feel like VIOS is. We really strive for that. We know that going through this whole process is very emotionally taxing, and we try to make it as comfortable as possible.
Yeah.
I always say we know that nobody wants to be here. Yeah. So we try to make it as easy as we can and make it comfortable, because it's a lot of personal information that they need to share. So we want to put them at ease.
That's a good point how you said that. How, nobody signs up for, I can't wait to go see the fertility specialist. You just think it's going to be as easy as it is in the movies, right?
Yeah.
Which brings us to perhaps one of our first questions. So how long on average, now this is going to be obviously very in general, but how long on average would it take for a woman to get pregnant after they start kind of seeking help with the fertility process?
Well, if the woman is less than 35, we really expect her to be pregnant within a year of trying. If she's over 35, we shorten that time frame to 6 months because we know that fertility declines naturally as we age. Women are born with all of the eggs that we're ever going to have. Once they're gone, which is very different for men who constantly make sperm from scratch.
Just yet another reason it's not fair.
Yeah, it's not fair. There's so many reasons that it's not fair. But there are other, there are certain symptoms or conditions where we would want someone to seek care earlier than the 12 or 6 months.
Okay.
If a woman's not having regular periods, you you have no idea when your period is coming, you should come in sooner because that could be a sign that you're not ovulating. If there's any concern that your tubes might not be open, so if you've had a history of chlamydia or surgeries in your belly, if you've had appendicitis before, those could all put you at risk of having tubal issues.
Appendicitis, really?
Yeah, because it's got the inflammation right by where the tube is. Endometriosis is another thing that could potentially block someone's tubes from scar tissue. So all of those conditions would make me want you to come in sooner so that we can do an evaluation and just make sure that everything is okay. Or if there's a reason to suspect that there could be a male factor. You know, in up to 50% of the cases, there's at least a male component, maybe not completely male, but men are not off the hook, okay?
This is not just our
not
problem.
just a female problem.
50%.
Yeah.
50%. So
Yeah,
that's kind of
That's
like
true.
relieve some of that burden of responsibility for women.
Well, I
No,
agree because I think most women come into the office thinking, I know it's me,
Yeah.
and so we always have to, evaluate the entire couple because it can be more than one issue,
Yeah.
and sometimes it's not the woman at all.
Correct. And men are very hesitant to get a semen analysis. So it's like the woman takes on the burden herself, but then her partner's also like, it's not me, it's you.
And you guys
know?
do all of
We
the
do.
analysis for a man as much as you do for a woman.
We do, so they can have their entire evaluation here with us.
Yeah. Now, if we do find an abnormal semen analysis and we feel like the man would benefit from additional evaluation, we work with reproductive urologists to get a more thorough evaluation, a physical exam of the man. But we do all of the initial stuff.
And I can imagine that the environment that you spoke to at the very beginning really comes into play there, because especially when you don't know, and you don't want to be like, let's talk about whose fault it is, because it's not fault.
Correct.
Right.
It's, it's just a biological challenge that is in
Absolutely.
place in one of the partners, or possibly both, who knows.
Yeah.
But like, there's always going to be these emotions tied to it, and the shoulds, especially with women, I imagine, I should be able to do this, or and having that environment of being, not in this kind of cold, harsh, sterile situation, and being able to talk through that and process that stuff can, I imagine, make such a difference.
It makes a huge difference. I often see when couples finally come in for evaluation, they're so relieved because they've been trying month after month and so much disappointment, and sometimes they even cry just from relief, just like somebody's coming up with a plan, we've got a plan in place. It feels better to be armed with information.
Yeah, and that validation of, okay, I'm not crazy.
Exactly.
It wasn't,
Exactly.
There's actually something going on. That's really, really helpful. I know we've had a piece written on our website about secondary infertility, and it's something that so I have 3 kids, they're 11, 9, and 7, and they were thankfully relatively easy to make happen. But the idea that, you can have 1, 2, or more children and then have such challenges having additional kids, I didn't know that was even a thing when I was having my kids. So what causes that, and how is that possible? How is that a thing?
And honestly, why does that seem so common right now?
Yeah.
I'm really curious to know. I guess maybe.
Well, my theory is that we're starting to have kids later, and so you have your first child when you're a little bit older, so you have your baby, you wait a year or 2 and try again, and you're even older. And so if your egg quality has changed in the interim, that can make it more difficult, not impossible, but definitely could make it take more time. Sometimes there's health changes that happen, medical conditions pop up that weren't present before in the female or the male partner. There can be processes going on like endometriosis that you mentioned, which causes inflammation and sometimes scarring, and that can get worse with time. So maybe you could conceive before, but maybe it's a little bit worse now and you need more help.
Okay.
So I think usually it's kind of just the woman is a little bit older.
And infertility is so common. Like we used to say 1 in 8 couples struggles, and then it was kind of 1 in 7, and now most experts think it's really more like 1 in 6.
Wow.
And why is that? Part of it is the age thing that Dr. Hayes was mentioning it, and there's also all sorts of environmental factors that are becoming more and more prevalent, you know, BPA
sure.
and plastics. There's all of these things that we're exposed to, you know,
Yeah.
radiation when you're flying in airplanes, you know, that we've known for a long time that pilots have lower sperm counts because of all
Seriously?
Yeah.
Oh my gosh,
Because of all the radiation that they're exposed to on a constant basis. So as people travel, that could have impacts. There's so many things out there, and you know, most people think it's like a threshold thing, like you're okay,
Yeah.
but then over time, you know, maybe 32 you're okay, 34 maybe not so much. So
And sometimes we see the converse where someone comes in to have their first baby and they need help with fertility treatment, and then they get pregnant on their own a couple of years later.
Then after
So-
Yeah.
Yeah, but at
Wow.
least then they have a plan in place. They can say, okay, well, if we're not pregnant in this length of time, we'll come back in.
Yeah.
And that's a really important point. Just because you struggle to get pregnant with your first child, that doesn't mean you don't need to use birth control if you're not ready to have a second child. Because
Excellent point. Yes.
because it can happen.
You never
Without
know.
any effort the second time.
Yeah.
You just don't know.
Dr. Hayes, can I have you expand on one of the things that you mentioned? You talked about the egg quality lessening as a woman gets older. What do you mean by the egg quality?
So, like Dr. Ehlers mentioned, women are born with all of their eggs. And
Yeah.
so, as we age, the eggs become older and they don't function as well. And we reduce our supply of eggs. So, by the time a woman goes through menopause, she has about 1,000 eggs left in her ovaries. So, we start with hundreds of thousands, and then we go through menopause around age 50. And in the interim, there's a transition where your eggs are working, you have lots of them, and then it starts to decline.
Yeah.
And it happens more rapidly when women get, you know, to their late 30s, early 40s, it becomes more pronounced. And what can happen is there can be a delay getting pregnant, or sometimes it results in getting pregnant but having miscarriages because the egg doesn't fertilize properly, and it results in a pregnancy that can't develop properly.
There's actually tests that we can do to kind of help assess a woman's egg quantity, like how many eggs she still has. It doesn't give an exact number. You know, you watch TV and they're like, you have 1 egg left. No. That's not.
And her name is Phyllis.
Yes. Yes. But it does say like you still have a lot of eggs. You're not exactly where we want you to be, or you don't have many. And you know, we have that testing here at VIOS. We call it the VIOS Pulse, and it's a combination of blood work and ultrasound, which is done when you're on your period. And it's a really good first step if you're like, oh, I don't know about my fertility. I kind of want to do something to see.
Almost like an assessment.
Yeah,
kind of.
It's the pulse of your fertility.
I see what you
it
did
also
there.
it also includes a semen analysis too. If that's something that is necessary, we do both evaluation for the female and the male.
So if your egg quality obviously is changing over time, I would love for you guys to talk a little bit about this idea of egg freezing and this process that, you know, is available. And I'm just fascinated. What is egg freezing and why would it be important, and who would that be for?
Because before we came on the camera, you should know, I was like, so is it like on the Mindy Project or not? And they both were like, we haven't seen it, we don't know. But so for those of you who have watched the Mindy Project, we're gonna kind of debunk, like, we love you, Mindy Kaling, you're wonderful and beautiful, and you're a treasure, but we're gonna let the eggs freezing go to the experts. So, okay, go ahead.
I think, so egg freezing is a relatively new topic and treatment that's offered. The reason being, for years and years, we could easily and carefully freeze embryos and thaw embryos, but we couldn't really freeze unfertilized eggs well. When we thawed them, often the eggs wouldn't survive. So in the last several years, we've perfected the technology to freeze eggs and have a high rate of eggs that survive being thawed out. So what that means is that you don't have to have a male partner in order to freeze embryos and preserve your fertility. You can be a single woman, or sometimes it's women who are planning treatment for cancer, things like that might affect their fertility. And you can go through a process where we stimulate a lot of eggs to form on your ovaries. We retrieve them with a minor procedure called an egg retrieval, and then we can freeze them the same day Then, years later, if you are having difficulty getting pregnant, those eggs can be thawed out, fertilized with your partner's sperm, and an embryo can be transferred into your uterus. So it's basically a fertility insurance policy for later.
And I think that it's really important to note that, like, women, when you're having cycles or whatever, you've got a group of eggs that start to grow every month, and those eggs are either going to be chosen to ovulate or they're going to die. And when we're freezing eggs, we are only stimulating those eggs to grow that month that we're going to grow or die anyway. We're not taking eggs from other cycles. We're not really changing your ability to get pregnant in the future. We're we're not taking all of the eggs out of your ovary so that you have to do IVF. We're only dealing with the eggs that were going to be used or lost that month anyway.
Interesting.
If that makes sense.
Yeah, it does.
It's kind of complicated, but
I think people are concerned that if they do that, are they going to run out of eggs sooner and
Yeah.
I
no.
see. Okay.
Yeah.
So as far as who would be a candidate, I mean, honestly, anybody could be a candidate. The earlier you decide to do that, the better, because the better your egg quality will be when you're a younger woman. And so when those eggs are thawed out, they're more likely to produce a good pregnancy. But I mean, we see women of all ages, even into their 40s, that want to come in and freeze eggs. Ideally, it would be best to do it probably in the first part of your 30s, if you can.
If you can, yeah.
I think we have a question from our audience.
We have a question. Sarah wants to know, can you increase egg quality then if you have a low reserve?
Ooh.
Well, you can't increase egg quantity, so numbers, that's done. Sometimes you can try to slow the loss. There are supplements that have been shown in some studies to help with egg quality. Coenzyme Q10 is one that has really been studied. Some people use DHEA, and there's a whole bunch of other things that have varying scientific studies on them, but it's something that we're always exploring and looking at. And we know that as women are waiting longer to have children, it's a very important topic, and we're trying to get all the answers.
Lots of research.
Yeah.
We're not
You can
there
only
yet.
technology can only and research can only move so
Yeah.
fast.
In
unfortunately,
general, you know, what you need to remember is it's difficult to reverse aging of the eggs. You know, supplements can help make eggs a little better if you're going to go through a treatment cycle. But the bottom line is, you know, the egg quality changes and there's not a lot we can do about it. So to be preventative and to potentially freeze eggs is the very best solution to that. And to come in, if you are having trouble getting pregnant, if you're actively trying to come in as soon as you think it's reasonable to do so.
One of the biggest things that can affect egg quality is smoking. I know that less and less people are smoking nowadays, but if you are smoking, if your partner's smoking, if you are around people who smoke, much of the time it is impacting your egg health, and it impacts sperm too. But like I said, with sperm, it's constantly being produced, so a guy stops smoking and he can fix all that damage, whereas a woman, she can't fix the damage that's been done, but she can help try to prevent future damage.
Yet another thing to hold over our children's heads when we're like, don't do it, because like well, and I worked with, like I mentioned, I worked with high schoolers, and I would have these kids coming in and like downing, you know, energy drinks, like 2 or 3 in a row, and it sounded like such an old fuddy-duddy, but I was like, you don't even know what that's going to do to you, and we don't know it yet, we don't know yet, like I'm like, for all you know, in 20 years, you're going to be, you know, trying to have, and not saying that this is what's going to happen. I'm just saying, like, but we, you know, it's like you were saying, you know, we don't yet know because we don't have that amount of time yet available to us to really see it. But we do have that amount of time with things like smoking and other environmental factors that we can see what's going on. I want to come back to that egg quality topic real quick again because it's just incredibly fascinating. And is there any genetic component to that? So like, if I knew that my parents struggled with infertility, and whether, I mean, at that time they probably didn't know if it was my mom, my dad, who knows, but if I know that my parents struggled, am I like more likely to struggle? Am I more likely, can that affect my egg quality? What role does genetics play in
That's a
infertility?
good question.
No, I think that that's a very important question. So there are certain things that can run in families. You're right, the tricky part is sometimes
Yeah.
if it's parents that were having difficulty conceiving and you try to inquire, well, what was your diagnosis? Nobody knows, because the
It was the
testing-
80s, who
the
knows?
testing wasn't quite as
Yeah.
sophisticated then.
Yeah.
But there are certain things to watch out for. So if your mother had endometriosis,
Which is what again?
which is
Explain that first, just a
inflammation.
minute.
Well, so endometriosis is when glands that are usually in the uterine lining, the cavity of the uterus that exit the uterus as you have your period,
Mm-hmm.
those types of glands can implant elsewhere in the pelvis and cause scarring and inflammation and changes in egg quality and those types of problems
Okay.
over the course of years.
Got it.
And that there is a genetic component to that. So if your mom and your sister have it, you might have it too. It's worth seeing someone to check
Okay.
into. Sometimes polycystic ovarian syndrome, women who don't have regular cycles and don't ovulate regularly, sometimes that can run in families as well. I think a really important thing to maybe ask your mom is, when did she go through menopause, or when did her mom go through menopause? So
Yeah.
sometimes you see in families, all the women go through menopause when they're 40 instead of 50, which is the average age.
Right.
And so in those cases, it's important to try to check your fertility and maybe have your children a little earlier, or at least see someone and get
Yeah.
that pulse on your fertility.
Because if you don't
wellness.
know, you might be like, oh, I've got all the time in the world.
You might
and then,
think you have the same amount of time as everyone else, and it's really individual. Egg quality changes at a different
Yeah.
pace for every woman, and that's why we have to test it.
Right, and
fascinating.
everyone's always talking about celebrities that got pregnant in their 40s or 50s,
Uh-huh.
and they're like, well, she did it,
Yeah,
so
exactly.
I should be able to. And we don't always know the true story behind the celebrities' pregnancies. Some of them may have frozen eggs or embryos when they were younger. Some may be using eggs from other women,
Who knows,
from
yeah.
donors. But you can't say, oh, she did it, so
Right.
I can too. So it's really important, like Dr. Hayes was saying,
Yeah.
it's individual. And don't use the fact that Janet Jackson got pregnant when she, I don't even know how old, to make it okay
Right.
that you've been trying for 10 years and still aren't pregnant.
or your friend down the street, or that woman in the
Correct.
Facebook group.
Absolutely.
And,
Yeah.
we fall into that comparison trap so often, and it can be just as easy to do that with something which is
Yeah.
arguably probably one of the most personal
Mhm.
experiences of your life, and to compare it to literally anybody else is probably
Well,
an
and
exercise
along
in
those
fertility.
lines, you may see someone, your neighbor, got pregnant when she was 45. You don't know what she went through to
Yeah.
obtain that pregnancy. You don't know if she used her own eggs or if she did multiple rounds of treatment. So you can't just assume that everyone is kind of
Yeah.
easily conceiving.
It's not the same playing field, no matter how
It's
much
not.
we might like it to think that it is. It isn't.
Yeah.
Having been around so many women and men that are having fertility issues, one of the questions that came in is, how can we best support friends or family who are going through issues with fertility? Because
That's a
obviously
great
it's
question.
extremely sensitive,
Mhm.
and it's hard to approach. But you may know a friend that is trying and has been trying. It's like, do you just keep asking? Do you not ask? How do
It's-
you ask?
It's
Yeah,
hard
it is
because
difficult.
what's good for one person is not going to be good for another person. Some people want to be asked and want to talk about it, and other people don't want to talk about it at all. I think that most people would agree that you shouldn't be like hounding them. When are you gonna have kids? When are you gonna have
Yeah.
kids? Because like you don't know what they're going through.
Yeah, they
or
may not voluntarily be postponing starting a family. They
Correct.
may be trying as hard as they can and having trouble.
Right,
Yeah.
or like if they have one child and have secondary infertility, like you shouldn't say, you already have one, so can't you just be happy with one? Like those aren't really supportive
Yeah.
things, but
Yeah.
it's hard to know exactly what you should say.
I think we see people come in and share their stories of all kinds of comments that they get from people, and I think people genuinely try to help and
Yeah,
say something
absolutely.
comforting.
Absolutely.
Most of the time, though, it doesn't land the right way. So I would suggest, if it's a friend, to say, I understand that this must be so difficult and I'm here for you. I'm not going to ask you, but if you want to share with me. I think that would probably be the best approach, because it kind of puts the ball in their court.
Yeah, let me know what I can do
Yeah.
to help and support you through this.
Yeah, that's awesome.
And I also wanted to say too, just as you guys were talking, and about this being it's such a sensitive topic, and people are coming in a sometimes really hard place. So impressed with when you come up here. Actually, like, it doesn't feel like you're walking into a doctor's office, and it doesn't feel like everyone knows I'm walking into a fertility institute. Like, nobody. It's very discreet up here too, which is really great.
Mm-hmm.
That's really nice. So that you can
Just
come
slip in the
here
back
and
of the
feel
mall.
safe.
Yeah,
That's right.
Yeah.
That's right.
One of the things that you mentioned when it came to egg freezing is that you said that, quite often you'll have like a woman who does not have a male partner who is wanting to have a baby on her own, or so do you have kind of arrangements then with donors to match with sperm donors, and I'm assuming also supporting other couples in the LGBTQ community
Absolutely.
that are being able to, can you just speak to that just a little bit when it comes to just, let's move outside of the realm of the traditional fertility situation into something like that? What does that look like?
we don't have any in-house sperm donors. We work with the major sperm banks. It's important that if you need donor sperm or donor eggs, that you go to a reputable site.
Don't go to the internet and buy one on eBay.
I really don't
No?
recommend.
Or Craigslist.
Or using
Or
your
Craigslist.
Yeah, using your neighbor,
Yeah. Heard
that's
it all.
not an
Perfect.
ideal thing.
If you take nothing else from the video, this is your tweetable moment. Don't buy sperm from Craigslist.
That's right.
There you
Is
go.
Craigslist still a thing?
Yeah. It is, but
Yeah.
you'll end up getting not what you want. I'm
So
sorry.
That's okay. So the sperm donors at the banks, they're all screened extensively. They undergo psychological screening, screening for infectious diseases, genetic screening. So they've done all of this process so that you can get like the cream of the crop type of sperm. The same is true with egg banks. So we work with multiple sperm and egg banks. It's important though that if you are wanting to pursue donor eggs or donor sperm, that you do come in and have a consultation, and don't buy anything without talking to a physician first to make sure that it is the right sperm or egg for you.
Perfect.
So I think, just to kind of build on that, I think egg freezing is for women who want, like I said, that insurance policy later. They're not ready to try now. There are plenty of single women who are ready to try. And so when they come in, we do evaluation and we can help get them pregnant using donor sperm. Also, LGBTQ community, we see a lot of those couples and individuals and can help them build their family in whatever manner they want to. Sometimes it's with anonymous sperm donors, sometimes it's with a directed sperm donor, so someone they know that we put through the screening, but it's maybe a sibling or something like that. Not a sibling of the person who's getting pregnant.
I knew what
you
you
know
meant.
what I'm saying.
I knew what
you
you
know
meant.
what I'm saying. And we have male couples that need to use an egg donor and a gestational carrier to carry the pregnancy, to have their family, and we can do all of those things and do that all the time.
Fantastic. Okay.
Science is amazing.
It really is.
I'm like
It's so cool.
floored by
Yeah.
so many of the things that you can do.
Yeah.
All right, we've got two big questions left that I want to make sure that we get to, and then we'll see if any other ones have come in as we wrap up. So the first one is, what do I need to know when I'm trying to conceive after a miscarriage, or possibly even multiple miscarriages? Because at that point, you know that you've lost several. Does that put you in a different position from your, I don't know, quote unquote standard infertility patient, or is that, I'll stop talking, you go.
Well, I mean, it's important to remember that miscarriage is incredibly common, and people don't always talk about them, but when you start talking about them with friends or family, you realize just how common and how often the people you know have had a miscarriage that you weren't aware of. So that's a different story than someone who has what we call recurrent pregnancy loss, which is 2 or more miscarriages without having a successful pregnancy in the interim. So there is a specific evaluation for recurrent pregnancy loss that we do just to make sure we can diagnose any treatable reasons and
Yeah.
prevent having another miscarriage. So there's a different kind of testing that we do for that situation. Some of it is the same as a fertility evaluation. Sometimes it is due to an
Yeah.
egg quality issue, so that's kind of common between the two types of testing. But some of it is just very specific to recurrent miscarriages too.
Yeah, and if you've just had one pregnancy loss, one miscarriage, there is no reason to think that you would be at risk for another one. And actually, if you are able to get pregnant within the first 6 months of the loss, it actually decreases your chances of having another loss. So you don't need to like wait 6 months and let everything figure out. You just need to have 1 or 2 normal periods and can go ahead and start trying again.
I did not know that. There you go.
Now, it's
That's
different.
encouraging.
Yeah, it's different
It's really
if you've had
encouraging.
2 or 3
Yeah.
pregnancy losses, like Dr. Hayes was saying. There is additional evaluation, but just having one, you shouldn't be afraid to try again.
That's
I mean,
really
stress, I
encouraging.
feel like the stress and like the anxiety has to play into this as well.
Yeah.
Do you
Oh,
guys
yeah.
address that as well?
Yeah.
Like
Oh,
the psychological side of the
Yeah,
evaluation?
absolutely. So, I mean, kind of across the board with fertility patients or recurrent miscarriage patients, we have recommendations for apps that work really well. There's one called Ferticalm that's fantastic. You can put on your phone and it kind of helps you address different situations that you come across when you're having problems with fertility and people
Oh.
say something ridiculous to you and you don't know how to respond and you're having some sad thoughts. So there's this great app called Ferticalm that is kind of like the first line recommendation, but we often do work with counselors and psychologists to help with that. But part of it, you know, like I alluded to, is just coming in and having a plan. And kind of getting your evaluation done, understanding the situation, and then you can kind of know what your next couple steps will be, and I think that feels better too.
Yeah.
And I think it's important for couples to take time, like where they're not focused on trying to get pregnant, like still schedule date nights, or you know, if a woman likes to read or take bubble baths to relax, like make sure you have time for that. Or if you like to work out, like try not to make your whole life about getting pregnant, because that does not help you psychologically. Acupuncture is also something that we'll recommend to help people who are struggling with stress. Sometimes people find that beneficial, but you need to know what works for you, and what works for me is not going to be the same as what works for Dr. Hayes or anyone
Again,
else.
highly
because
individualized.
It's so
Very
individual.
And I think a lot of women come in worried that their stress level has contributed to their infertility or their miscarriages. And I tell them, don't stress about your stress.
Right.
That's really not going to be be the reason.
It's like you're talking to me right now, but not in the fertility realm. Like, stop stressing about your stress.
Everyone
You have
has
the tattoo of that.
stress.
Yes.
These topics are incredibly stressful, but don't stress about your stress.
Yeah.
You know, find ways to cope with it, and we're going to figure out medically what's going on.
That's tweet number 2. Number 1, don't buy semen on Craigslist. Number 2, don't stress about your stress.
Exactly.
Right, we do have one question that came in
You
here
beat me
that
to
I'd
it.
love to make time for. Is any advice for older moms? So,
I believe she mentioned she's 41.
yeah, she's had 2 kids. It was easy. But just in general for older moms.
Yeah, best
like,
piece of advice.
Yeah.
Check
And
your
maybe
pulse.
to potentially
Yeah, I
Get
would
the
say
pulse.
the best thing to do is just don't wait too long. You know, when I see someone come in who's 43 and they've been trying for 3 years, it's possible we won't have as many options that we can offer at that point than if we had gotten them in a little bit sooner. But again, it's individual.
Yeah.
So if you're trying and you're over 35, come in for evaluation after 6 months. Or if you're just curious and you want to see where things stand, you could do the pulse testing anytime and just get some peace of mind, or know whether or not you should come in for a full consultation.
There you go.
Yeah, and if you're in
Don't
your
wait.
40s and are just starting to try, you can come in before you've tried for 3 months or 6 months.
Yeah.
We're happy to talk to you about what we recommend and look and see what your egg reserve is, because we may recommend pursuing some kind of treatment sooner rather than later, just depending on the individual situation.
And it depends on what their idea of a complete family is. So if they come in and they're 40 and they just want one child, that's very different than someone who comes in at 40 and wants 3 children.
Oh,
So
very much so,
we
yeah.
may offer different things just, you know, to get them pregnant at the time, but maybe preserve the option for future pregnancies
Right.
too.
Yeah, and coming to see us doesn't mean that we have to do IVF. I know lots of people worry about that they go see a fertility doctor, then that means they're going to have to do IVF and all the shots and take the eggs out and combine it with the sperm in the laboratory and put it back in. And a lot of people were able to get pregnant with much lower tech treatment, like oral medications and inseminations, where we just put the sperm in the uterus at the right time. So don't make assumptions and say, oh, I don't want to do IVF, so I don't want to go talk to them, because you may not need it.
There you go. Yeah, so I think we want to wrap up because I know that we've kind of hit that 30-minute mark, so we want to respect everybody's time. But there's obviously so much that we could continue to talk about, because this topic, as we've landed on and time again, is highly individualized. So literally, if you have any questions related to this topic, the gals here, the doctors at VIOS Fertility Institute, are more than happy to chat with you. Come in to get that pulse, hit them up on Facebook, call the office, get in contact, because as you can see, just even from this environment, they make it so easy and so welcoming to get your questions answered. And there's no such thing as a stupid question when it comes to your reproductive health.
No.
I think as women, we get so hung up on that should, and I know I keep coming back to that, but that should is such a dangerous area to be in, and there's no normal when it comes to your experience, and finding the right fit for you is so important. So we want to thank Dr. Ehlers and Dr. Hayes so much for taking the time out of your evening. And again, we've tagged VIOS Fertility Institute in the description of this video. We will pop the website in here as well. Please do reach out with your questions. I'm sure they would love to hear them.
Absolutely.
We would.
Thank you very, very much. This is the part where I awkwardly stand up and come and hit the finish video. So thank you so much.
Thank you for having us.
Good night.